So the congenital cardiac diseases. The first is aortic stenosis, then pulmonic stenosis, PDA, which is patent ductus arteriosus, ventricular septal defect, and number 5 is tetralogy of the fallet. The congenital surgeries are PRAA, which is persistent right aortic arch, and PDA, which is patent ductus arteriosus. So when do we consider the presence of a congenital heart disease in dogs? So look for a cardiac murmur, and it has to be a grade 3 to 4. It has to be in young animals less than 1 or 2 years old, and there's usually a sudden death in a newborn puppy. The symptoms are cyanosis, dyspnea, exercise intolerance, and restricted development. The diagnosis. So in the first vet visit, there's almost always an audible murmur. In most puppies, there's a functional murmur, and it's a soft murmur. It's due to physiological anemia, and it's usually grade 2 out of 6, and will disappear with age by the time they're 6 months old. However, in a congenital heart disease, the murmurs are always loud, often with fremitus, and they're permanent, so you should always do an ultrasound. In systolic murmurs, the sound is heard between the 2 audible sounds, and in diastolic murmur, it's heard after the second sound. And in both systolic and diastolic murmur, this is caused by patent ductus arteriosus. The main congenital cardiac diseases in dogs are aortic stenosis, pulmonic stenosis, patent ductus arteriosus, PDA, then ventricular septal defect, and tetralogy of fallet. In aortic stenosis, this is a narrowing of the aortic valve. It doesn't fully open, which reduces the blood flow from the heart into the aorta, and as a result, reduces blood flow to the rest of the body. It's usually subvalvular, and it causes left ventricle hypertrophy. It's found most commonly in boxers, and also Newfoundlands, German Shepherds, and big dog breeds like Golden Retrievers, Rottweilers, and Bull Terriers. In pulmonic stenosis, the pulmonary artery is too narrow. It's usually valvular, opposed to aortic stenosis, which is subvalvular, and it's also found in boxers, and it's also found in English bulldogs and Samoyeds. It causes severe right ventricle hypertrophy and a bulging of the pulmonary artery. On an ECG, the terminal portion of the QRS is enlarged, but the T wave is normal. And the third disease is PDA, patent ductus arteriosus. So during the embryonic stage, the aorta and the pulmonic artery share an artery, and this should close after birth and become a ligament. But in this case, it remains open, which leads to excessive blood flow to the pulmonary circulation, and it's the most commonly leading factor of left congestive heart failure. In this disease, you'll hear a continuous murmur due to the secondary mitral regurgitation. It's most commonly found in poodles, miniature poodles, and German Shepherds. Females are much more predisposed to this disease. There's a 3-to-1 ratio from females to males. It causes left ventricle and left atrium dilation, and the trachea is also pushed upwards, and you'll see an enlarged left ventricle and secondary pulmonary edema. The fourth disease is ventricular septal defect. In a large septal defect, it's easily recognizable. You can place a transducer to the wall and you can see the hole. In a small septal defect, it usually needs a Doppler for diagnosis, and it's usually beneath the origin of the aorta. Most ventral septal defects cause a left to right shunt. The left-sided cardiac dilation, which is a small defect, is not causing much problems, but a right-sided cardiac dilation, which is a large defect, so the right side becomes dilated as the pulmonary artery cannot let through excess amount of fluid. This is a large defect. It can turn into a right to left shunt, so a reverse PDA. It goes from right to left and causes cyanosis. And the fifth disease is a tetralogy of fallet. It's a combination of multiple congenital abnormalities, such as the ventral septal defect, the pulmonary stenosis, and an overwriting aorta, or a riding aorta, and right ventricle hypertrophy due to pulmonic stenosis. And the outcome is mixed blood. You have hypoxemia and then elevation of the hematocrit. So for the treatment of the congenital cardiac diseases, so in the case of a PDA, you can use a ligation or a catheter closure. This is the only cardiac disease that we can truly treat. These congenital cardiac diseases in cats are much more rare. So for the example, the ventral septal defect in cats is 15%, the patent ductus arteriosus is 11% in cats, and the tetralogy of the fallet is 6% in cats. So surgery of congenital heart issues. So PRAA, which means persistent right aortic arch. So normally everything should be left, And since it's right, this is especially a problem when foods are introduced into the diet and causes gradual strangulation of the esophagus, which causes cranial megaesophagus. It's mostly in dogs and it's rare in cats. On an X-ray, you can see the esophagus is noticeably dilated. Surgery is an absolute indication. There's a strict approach, a left lateral thoracotomy at the fourth intercostal space. You ligate and transect the Bartoli ligament, and then you do a dissection and a balloon dilation of the strangulated esophagus. And when operating on a PDA, patent ductus arteriosus, it's most frequently a left to right shunt, which causes mixing of O2 and CO2 in the blood. The surgery aim is a closure of the PDA. The patient must be a young animal and must have a left to right shunt. Patients older than 1 year old have an increased risk of complication. The approach should be a left lateral thoracotomy in the fourth intercostal space. Make a hole cranial and caudal to the PDA between the aorta and the pulmonary artery, and you do a double or triple ligation of Bartoli with non-absorbable sutures, and make sure you avoid the phrenic nerve.